life updates and comments. Now to health matters, gynecologists and consultants have advised Nigerians to embrace the solutions that assisted reproductive technology brings in putting smiles to faces of parents who cannot conceive naturally. Chief Medical Director of the Lagos State University Teaching Hospital, Professor Adetokunbo Fabunwu, gave this advice at an event to mark the 20th anniversary of Bridge Clinic. Professor Fabunwu, who says the myth concerning assisted reproduction has been completely removed in developed countries, explains that Nigeria is a bit behind as technology is catching up with the Nigerian culture. For the founder of Bridge Clinic, Dr. Richardson Ajayi, who doubles as the chairman of LASUTH, he says Nigerians should see fertility as a medical problem and therefore needs treatment. He also assures that the partnership with LASUTH, that is the Institute of Fertility Medicine, IFM, will continue to help those who cannot afford ART.
Just as we have applied technology in all other spheres of our lives, in communication, in transportation, in everything, technology has improved human life. So in the field of conception, I remember, for instance, as a gynecologist, the frustrations we faced many years ago when you got to a dead end and you knew there was nothing more you could do for an infertile couple. You knew that there was just no hope.
There's nothing more difficult for a doctor than providing a service that patients can't afford. So with Lagos State, we provide a subsidized service in LASUTH for those who cannot afford the fees of the Bridge Clinic. It's not a regular service because we clearly don't want to cannibalize the Bridge Clinic service, but we provide it, and it's been running now for about 8 years.
Meanwhile, some other speakers at the event, including Professor Fabunwu, dispelled some of the stigmas attached to assisted reproduction and affordability.
Because even in the social environment, not having a child is really worrying to a lot of families. You get married and the next month, everyone is looking at your tummy, where is the baby? So it's actually a very huge stigma when it started. But there's been a lot of awareness in the field. And according to the WHO, infertility is a disease. And like all diseases, we have to treat it. And so it's no longer, so the stigma is actually reducing because there's been a lot of foundations too that have helped us, really propagate it.
We're offering assisted conception at much reduced cost. People that would not be able to afford to go to fertility clinics in town, we're able to help them, and we've been getting a lot of good results.
Now, the need for the full implementation of the